Your host, Maryam Mkwanda, coming to you live from Robert Sharma Gauteng. It is 12:36 on this lovely Tuesday afternoon, Tuesday noon, the 22nd of September 2020. The weather is quite nice outside, definitely my kind of style. That's why I got my blazer on today, because, yeah, the weather said, you know what? I'm going to give you a blazer today. And it did exactly that. I'm proud of you. Anyways, moving on, today we're going to be talking about treatable infertility in women with our OBGYN, Dr. Tom Mokoya. So, if you're having trouble getting pregnant, you may have infertility issues, but that's not the end. So, just hold on right there. You need to visit your doctor, your OBGYN, and find a treatment that can help. But first, let's understand infertility a bit. Dr. Tom is joining me on the other side. Good day, Dr. Tom.
Hi, good day to you and good day to your listeners.
Thank you for joining me once again. So, Dr. Tom, what causes a female infertility?
Good question. Now, before I even say what causes female infertility, let me give a simple description of what infertility is. Infertility essentially means a couple that stays together and has what we say as they have regular sexual intercourse, and they try to have a baby, and it takes them anything from 9 months to 12 months, and they fail to fall pregnant. Then a couple like that, then we consider that they probably have failed to fall pregnant, and therefore they are infertile. And now, coming next to what the causes are, it's important to realize that even if it's the woman who falls pregnant, the man can also contribute to infertility in the couple, because it's a couple that is infertile. It's not an individual who is infertile.
Yes.
And therefore, we have both female and male factors. But obviously, the first port of call is when a woman goes to see a gynecologist, because she's the one who has not fallen pregnant. Now, the causes of failure to fall pregnant are many and varied, but I can probably describe them as one where there is a hormonal problem, because hormones are important in the whole process of fertilization. So when there is a problem with the hormones. Two, when there is a problem with the tubes. And with the tubes, it can either the tubes are blocked, or around the tubes there is endometriosis. And then we move to the uterus. It means that the uterus has a malformation, either what we call as uterine synechia, where the lining of the womb is not normal, or there are fibroids. So, I mean, that is just a basic overview of what may cause infertility. There are many other reasons that may cause infertility, but those are the common ones. And when we go to the male fertility, it could be that the sperm count is low, or the sperms are not strong enough to run up the tube. So there are also male factors which may be associated with the sperm motility and the morphology of the sperms.
All right. So, doctor, how is it diagnosed?
Now, the diagnosis in medicine, diagnosis is a 3 or 4-step procedure. The first step that we take is we take the history. So the history means one asks the questions where you look for the signs and symptoms. How often do they meet? Do they meet just once in a while? One partner is in Cape Town, one is in Joburg, and they meet once a month. That may be a problem. So the history is important. And then, of course, one also needs to find out the history from family members, whether there are any other family members who have a problem. Because you may find that some things tend to run in the family. And then after that, we go to examination, where we do an examination to see whether it's a patient is obese, or underweight or overweight. And then after that, we do examinations. We do things like ultrasound. And then if the ultrasound doesn't give us any diagnosis, then we go and do what we call as laparoscopy, or we check whether the tubes are open or not. So it's a whole spectrum of things we have to do. And for the male, we have to do what is called as a seminalisis. So we have to analyze the sperms.
All right.
So that
Now,
is the
as I
process we
was,
go when we are doing investigations.
there was something that looked like a pap smear. What is that all about, and how does it work out? Is it like a pap smear?
Now, when we are doing the investigations, we also do a pap smear. Now, when you're doing a pap smear, although the pap smear is specifically not part of the investigations for infertility, but it's essentially part of the things that we do to make sure that the woman does not have cancer of the cervix. Because if there's cancer of the cervix and the cervix is blocked, one may struggle to fall pregnant under those circumstances.
All right. So, doctor, does age play a role in infertility?
Sorry, I think I'm losing you again.
Age. Can you hear me now, doctor?
Now, age is a very important factor, and it's one of the things that we take note when you're taking the history. And as most of the people will know, that the older one gets, the more difficult it is to fall pregnant. And that is because as one gets older, the number of eggs that are fertile in the ovaries, we call them follicles, decrease. And they start decreasing from the time one is born. When one reaches 36, the rate of decrease increases. So up to by around the age of 40, you find that they have significantly reduced. So the age at which one wants to fall pregnant is very, very important. Obviously, that's why one struggles to fall pregnant when they are 50, because the follicles that that can be fertilized are significantly reduced. So age is indeed a very important factor. And however, one can still fall pregnant much later, but it takes a little bit longer to fall pregnant. And even when we do investigations, we find that because the older one gets, we don't have a lot of time, let's say, to take out fibroids and wait for them to fall pregnant. So the younger the patient, the better the prognosis, the outcome of pregnancy, as it were.
And what about the treatment? What treatment is involved in this whole process?
Now, the treatment, once we have made the diagnosis, and depending on what we found, if let's say, for example, it's a problem with the tubes that are blocked. If the tubes that are blocked, there's a possibility that one can do microsurgery to open the tubes. And depending on which part of the tube is blocked, one can be able to attempt to do microsurgery. It's an expensive procedure. It can be done. The success rate is probably between 5 to 50%, depending on where the tubes are blocked. So that is one form of surgery. And the other form of surgery we do is that if one has fibroids, those can be taken out. If one has a fallopian tubes or the uterus, which is malformed, what we call as uterine synechia or uterine biconate, those ones can be managed by surgery. The other form of surgery we do is if a patient has endometriosis, which will prevent the fallopian tube from picking up the egg, we can do surgery to correct the endometriosis, take out the endometriosis and make sure that the fallopian tubes are open. That is one form of management. The other form of management in patients who have hormonal problems, where they are not able to ovulate, what we call as anovulatory cycles. Now, here we use what we call as medical management, where we give them ovulation stimulants because they are not able to ovulate every month. And obviously, we do investigations to make sure that they can't fall pregnant because of an ovulation. Then we give them ovulation stimulants, and there are very many of them that are in the market, like Clomid, which is the commonest, and we can use Femara. But it's important to know that when those ovulation stimulants are given, they have to be monitored, because there's a possibility that one can easily overstimulate the ovaries, and then they become very big, and one theoretically can develop twins, and that is the medical management. And when we actually start with the conservative management. Conservative management is if somebody walks into my room and they are theoretically obese, and they're struggling to fall pregnant, we tell them to go and lose weight. If somebody is a heavy smoker, then we go and tell them to stop smoking. So essentially, it's lifestyle change, and this lifestyle change is for both the man and the woman. There are men who have a low sperm count because of their lifestyle, and the lifestyle includes either excessive drinking, excessive smoking, or they are excessive weight, because weight does affect the way in which the ovaries ovulate. And it's also important to know that it's not just somebody who is overweight, even people who are underweight, because they are practicing for the Comrades Marathon or they over exercise. Then we go and tell them to change their lifestyle so they can be able to ovulate.
All right, Dr.
So
Tom,
there's a
please
whole
stay on the
spectrum
line.
of those combinations that are available to us.
All right, okay, Dr. Tom, no, that's okay. I thought that we were going to take a break, but I've just been informed that we can continue. Can we, or rather, is there natural ways to treat infertility, or are there over-the-counter medication to take?
Some of the natural ways of treating infertility, those are ways in which one changes the lifestyle, as I said. Now, in some instances where these methods of treatment fail, which are the ones I've mentioned before, then one may consider going for an in vitro fertilization. In vitro fertilization is where an egg and the sperms are collected, and fertilization is done outside, and then the egg is transferred. The fertilized egg, or the embryo, as we call it, is inserted into the uterus, and then of course the baby grows. So now that is at the end of the spectrum, when all natural and conservative and surgical methods have failed, and one is now going to the next phase of trying to have a baby. And one is to note that IVF is a relatively expensive procedure, and you may find that being done in the public hospital, but most of the time they are done in private clinics. So one needs to consider the fact that it is associated with a cost. There's always a cost involved.
Speaking about cost involved, is infertility evaluation affordable?
Sorry, I think I'm losing you again.
Speaking about costs involved, is infertility evaluation affordable?
About the costs.
Did you get that, Dr. Tom?
No, I didn't get that question.
All right. Is infertility evaluation affordable? All right, Dr. Tom, I'm not sure what is happening over there, but is okay. Is infertility evaluation affordable?
Yeah, I know I'm live. I think we've lost the connection.
All right, we have lost a connection with Dr. Tom once again. But Dr. Tom, thank you for your time and for that knowledgeable insight regarding treating infertility in women. Um, Dr. Tom is an obstetrician and gynecologist operating at Netcare Hospital in Sandton. So, yeah, if you need any more information, you may send us your comments, questions, queries, or suggestions to our WhatsApp line on 061 766 Alternatively, you can leave the comments in the comment section below, and we will pass them on to Dr. Tom Mokoya. Once again, we are talking about treatable infertility in women, and it is an expensive process. But stay with us. We will be right back after the break.